Diarrhea. It's a word that evokes a universal grimace. This incredibly common digestive issue affects millions globally, often causing discomfort and disrupting daily routines. While often a minor inconvenience, understanding diarrhea is crucial, as it can sometimes signal more serious health conditions. Imagine this. You're about to give that big presentation, and suddenly your stomach churns with an urgency that can't be ignored. Or you're traveling abroad, enjoying exotic cuisines, only to find yourself tethered to the hotel bathroom. We've all been there. Diarrhea, characterized by loose, watery stools, is usually temporary and resolves on its own. However, its impact on our lives, even for a short period, can be significant. That's why recognizing its symptoms, understanding its causes, and knowing when to seek medical help is vital. This essay aims to provide a clear and concise guide to understanding and managing diarrhea. We'll explore common symptoms, delve into the various causes, and discuss effective treatment options, empowering you to take control of your digestive health. Diarrhea often announces its presence with a symphony of uncomfortable symptoms. While the hallmark sign is frequent, loose, and watery stools, other symptoms may accompany this digestive distress. Abdominal cramps, a common companion to diarrhea, can range from mild discomfort to intense cramping pain. Bloating, a feeling of fullness and pressure in the abdomen, often adds to the discomfort. Nausea, that queasy feeling in your stomach, may also surface, sometimes escalating to vomiting. The urgency associated with diarrhea is another telltale sign. It's that sudden, overwhelming need to use the bathroom, often leaving you with little time to spare. Some individuals may also experience a loss of bowel control, leading to accidental stool leakage. Other symptoms, such as fever, blood in the stool, or mucus in the stool, can indicate a more serious underlying condition. It's essential to pay attention to these symptoms and seek medical attention if they arise. Diarrhea, like a malfunctioning machine, can stem from a variety of causes. Identifying the root cause is crucial for effective treatment and long-term management. Infections, often contracted through contaminated food or water, are among the most common culprits. These infections, caused by bacteria, viruses, or parasites, trigger inflammation in the gut, disrupting its normal function. Certain medications like antibiotics can also disrupt the delicate balance of gut bacteria, leading to diarrhea as a side effect. Dietary factors play a role too. Intolerance to certain foods, such as lactose intolerance, can trigger diarrhea after consuming dairy products. Chronic conditions, such as irritable bowel syndrome, IBS, Crohn's disease, and ulcerative colitis, can manifest as recurrent or persistent diarrhea. These conditions require long-term management to control symptoms and prevent complications. Other factors, such as stress, anxiety, and certain medications, can also contribute to diarrhea. Understanding these various causes empowers you to make informed decisions about your digestive health. While diarrhea can affect anyone, certain individuals are more susceptible to this digestive woes. Understanding these risk factors can help you take preventive measures and seek timely medical attention. Young children, with their developing immune systems, are particularly vulnerable to infectious diarrhea. Their constant exploration of the world, often involving hand-to-mouth activity, increases their risk of encountering diarrhea-causing germs. Older adults, especially those with weakened immune systems or underlying medical conditions, are also at increased risk. Their bodies may have a harder time fighting off infections, making them more susceptible to complications from diarrhea. Individuals with compromised immune systems, such as those undergoing chemotherapy or living with HIV/AIDS, are highly susceptible to infections, including those causing diarrhea. Their weakened defenses make it crucial to prioritize hygiene and food safety. Travelers, especially those venturing to developing countries, often encounter new foods, water sources, and hygiene practices. This exposure to unfamiliar bacteria and parasites can increase their risk of travelers' diarrhea. Section 5. Diagnosis. Determining the root cause of your diarrhea. Diagnosing the underlying cause of your diarrhea is like solving a medical mystery. Your doctor acts as a detective, using a combination of tools and techniques to identify the culprit. The journey begins with a thorough medical history, delving into your symptoms, their duration, and any recent travel or dietary changes. Your doctor may inquire about any medications you're taking, as well as any pre-existing medical conditions. A physical exam follows, allowing your doctor to assess your overall health and check for any signs of dehydration, abdominal tenderness, or other red flags. Based on these initial assessments, your doctor may recommend further investigations. Stool tests, analyzing the content of your stool, can detect the presence of infections, inflammation, or other abnormalities. Blood tests may be ordered to rule out systemic infections or other underlying conditions. In some cases, imaging tests, such as a colonoscopy or endoscopy, may be necessary to visualize the digestive tract and rule out structural abnormalities or inflammatory bowel diseases. Section 6. Treatment: Effective ways to manage diarrhea. Treating diarrhea effectively involves a two-pronged approach, addressing the underlying cause and managing the symptoms. This often requires a combination of lifestyle modifications, over-the-counter remedies, and in some cases, prescription medications. For mild cases of diarrhea caused by viral infections or dietary indiscretions, over-the-counter medications like loperamide, commonly known as Imodium, or bismuth subsalicylate, better known as Pepto-Bismol, can provide relief by slowing down bowel movements. However, it's crucial to consult with your doctor before taking any medications, especially if you have pre-existing medical conditions or are taking other medications. Self-treating can sometimes mask underlying conditions or interact with other medications. If your diarrhea is caused by a bacterial infection, your doctor may prescribe antibiotics to eliminate the infection. In cases of parasitic infections, antiparasitic medications are necessary to eradicate the parasites. For individuals with chronic conditions like IBS or inflammatory bowel disease, managing diarrhea often involves a multifaceted approach, including dietary modifications, stress management techniques, and medications to control inflammation and regulate bowel movements. Section 7. Home remedies: soothing your symptoms naturally. While seeking professional medical advice is crucial, especially for severe or persistent diarrhea, several home remedies can help soothe your symptoms and support your body's natural healing process. One of the most important aspects of managing diarrhea is staying hydrated. Diarrhea can lead to significant fluid loss, leading to dehydration. Sip on clear liquids like water, oral rehydration solutions, clear broth, or diluted fruit juice throughout the day to replenish lost fluids and electrolytes. Avoid sugary drinks, caffeine, and alcohol, as these can worsen diarrhea. As your symptoms improve, gradually reintroduce solid foods into your diet. Start with bland, easy-to-digest foods like toast, rice, bananas, and applesauce. Probiotics, often referred to as good bacteria, can help restore the balance of gut bacteria, promoting digestive health. You can incorporate probiotics into your diet through yogurt with live active cultures, fermented foods like sauerkraut or kimchi, or probiotic supplements. Rest is crucial for your body to recover and fight off any underlying infections. Listen to your body and allow yourself ample time to rest and recuperate. Section 8. When to seek medical attention. While most cases of diarrhea resolve on their own within a few days, certain red flags warrant prompt medical attention. Ignoring these warning signs can lead to complications and delay necessary treatment. If your diarrhea is accompanied by a high fever, over 102 degrees Fahrenheit or 39 degrees Celsius, severe abdominal pain, bloody stools, or signs of dehydration like excessive thirst, dry mouth, dizziness, decreased urination, seek immediate medical attention. Persistent diarrhea, lasting longer than 2 days in adults or 24 hours in children, also warrants a visit to the doctor. This could indicate a more serious underlying condition requiring medical intervention. Unexplained weight loss, persistent vomiting, or diarrhea that wakes you up at night are also red flags that should not be ignored. These symptoms could signal a chronic condition or a more complex digestive issue. Remember, it's always better to err on the side of caution when it comes to your health. If you're ever in doubt, reach out to your healthcare provider for guidance. Section 9. Prevention: Simple Steps for a Healthier Gut. Preventing diarrhea starts with understanding its causes and adopting simple yet effective hygiene practices. By incorporating these preventive measures into your daily routine, you can significantly reduce your risk of experiencing this digestive discomfort. Hand washing is your first line of defense against diarrhea-causing germs. Wash your hands thoroughly with soap and water for at least 20 seconds, especially after using the restroom, changing diapers, handling raw meat, or coming into contact with animals. Food safety is paramount in preventing foodborne illnesses that can lead to diarrhea. Cook food thoroughly, wash fruits and vegetables before eating, and store food properly to prevent bacterial growth. Avoid consuming unpasteurized dairy products or raw or undercooked meat or seafood. When traveling to areas with potentially unsafe water sources, stick to bottled water, avoid ice in drinks, and be cautious of fruits and vegetables washed with tap water. Peel fruits yourself and opt for cooked vegetables to minimize your risk. If you have a weakened immune system, talk to your doctor about additional precautions, such as avoiding contact with sick individuals and getting vaccinated against common diarrhea-causing viruses like rotavirus. Section 10. Conclusion: Taking control of your digestive health. Diarrhea, while a common and often self-limiting digestive issue, can significantly impact our well-being. By understanding its symptoms, causes, and treatment options, we can approach this digestive discomfort with knowledge and empower ourselves to take control of our gut health. Remember, prevention is key. By adopting simple yet effective hygiene practices, making informed food choices, and staying hydrated, we can significantly reduce our risk of experiencing diarrhea. When diarrhea strikes, listen to your body. Home remedies can provide relief, but seeking professional medical advice is crucial, especially for severe, persistent, or concerning symptoms. By staying informed, practicing preventive measures, and seeking timely medical attention when needed, we can navigate the world of digestive health with confidence, ensuring that diarrhea remains a minor inconvenience rather than a major disruption to our lives.